My name is John K. Arnold, and I've been working in the insurance industry since 1982. That's for over 27 years. I work both domestically with U.S. health insurance and also internationally with international health insurance. Yes, we need some changes here in the U.S., something to change our health care system, but nothing is perfect. Let's take what works well in other countries and combine it with what works well here. What we need to do, in my opinion, is focus here on primary care. We need to make primary care the first line of medical care, whether you call it defense, that we have. What seems to be working well in a lot of other countries is they do have that primary care access. What I propose we do is set up a national, public HMO system. This would be a plan that everyone in the U.S. could get, irrespective of their age or their health or their financial status. It would be available to everyone. What we would do is make it at little to no cost for the person to be in. Now what we also need to do is focus on what we do an astounding job of in the U.S., and that has to do with emergency care. It has to do with high technology, surgeries, cancer treatments, and research. And we need to encourage that. And the way we're going to encourage that is to continue and implement it such that insurance companies are involved in combination with the government and with the doctors. So we work towards that. So let me lay this out for you. The National Public HMO system would have a cap on it of, let's say, $5,000 maximum benefits to $10,000. That is where the majority of care will occur. Actually, it's under $2,000. People will all be able to go to the doctor. No one, if sick or injured, would not be able to go to the doctor. This would take the strain off the emergency room system. And with that strain being gone, a lot of our costs can go down. With everyone having access to primary care, we could encourage wellness and we could encourage prevention. We could have someone come in early and find those illnesses up front before they get to be enormous bills. So that would be available to everyone. But people could opt out. They could buy private insurance or use their employer insurance. Well, why would you want to do that? Well, there's some reasons why. You could have a variety of choices and plans. You would have a private health care system. What you find in other countries is, yes, there is a national system. But people do go to their own private doctors. They often sometimes carry other insurance or pay for services themselves. Those plans often have a wait and do have restrictions. Now, you could buy private health insurance and opt out of the national system, and that way you could have choice that you want. But everyone can be included now, and that's what we want to do. Let's encourage everyone to work together instead of the adversarial positions they all take. Government and industry can be partners in solving this problem that we're all looking to solve. In my plan, we're going to need more doctors. We are definitely going to need more primary care physicians. In some countries, they look to keep a ratio of that, and that's what we want to encourage. We want to be sure that everyone has access to health care, and they want to be sure that everyone has a choice of what they want to do with it and how they want to handle it. So let's keep our freedom of choice. Let's include more people. Let's give ourselves some options. Let's not put this burden on the employers. Our small business employers are having a hard enough time as is right now, and they simply don't need to be, mandated with more problems. Mandates can also seem to be politically expeditious. In other words, we'll mandate that they do this thing. Well, what doesn't come out of that is the fact that every single mandate has a price. It isn't free. It may buy votes. And one of the things we need to look at is not about what's going to get the most votes, but what working together will do to give everyone access to health care. This is my plan. I haven't seen it anywhere else. I do have experience in the industry to draw from, and I believe this plan can be implemented and can work for our country and take us into our next phase for the next 30, maybe 40 years. Thank you.